I want to go ahead and introduce Dr. Jenica Jenkins. She's from Sierra College, and she is going to discuss her campus's higher education collaboration efforts. Jenica, are you there?
Yes, can you hear me?
Yes, hi.
Hi, thank you so much for giving us this opportunity to share our programs with all of you. We're working diligently to make sure that we are not only building bridges for our students between the universities and ourselves, but also the communities. And then one thing we've noticed is since we're in at the end of the second year, the students that have transferred to CSU and UC Davis, those are our two neighboring universities because we're at Sierra College, they are accessing mental health there as well. We only know this not by formal data, but from students when they come back to visit, they say, you know, I went to the CAPS at UC Davis, or I went to the College Health Center at CSU, and they were great, and they helped me just as much as I get help here, which is amazing. So one thing that we want to make sure is when we're having these relationships with UC Davis and the CSUs is that our relationship, the development of each relationship is based on the goal of helping all the participants. So when we connect with CSU, not only are our needs being met, but we're helping to help meet the needs of CSU as well. So one thing that we've got in place with CSUS Sac State is we have master's level student fieldwork students in counseling and in the MFT program. They are working in our health center providing counseling hours, about 6 hours a week, and we have 2 fieldwork students at this point. We are interviewing for some other placements. So we're offering about 12 hours of counseling every week, which we weren't able to before because of our relationship with the CSUS fieldwork. We hold the interviews for those students here at Sierra College, and we collaborate with the university there. They have to be, of course, in the fieldwork course. We've funded the fieldwork supervisors, which are licensed therapists, and those licensed therapists also provide therapy for our students through the health center. Basically, we offer 6 sessions of personal counseling through our health center by using the CSU fieldwork placements and the therapists which supervise them. And then because we've had our regional forums and we do our mental health collaborative with the agencies and county and some private practices, we're able to assess what the student needs, where they would fit best, what they can afford, what they can't afford. And then we actually have a warm handoff philosophy where we say, well, you've done your 6, and, you know, do we feel like you can continue with this person? But it's a person we know because we've had the grant. It's a person that we have a relationship, and they've said, hey, as part of your sustainability plan, we will provide services to Sierra College students, you know, and so that's something that is really wonderful. It's a really good feeling to be able to get in and do a nice intervention and then hand them, warm hand them to someone in the community or when they transfer to where they're going to get a continuum of care, because that's what people need. The CSU trainings, they've invited us to numerous trainings. We've invited them to numerous trainings. They have done assist trainings, mental health first aid, peer programs trainings, residence hall trainings, other mental health trainings as far as identifying and treating specific issues. Basically, with our relationship, if we're having a meeting where we have a specialist coming to educate our counselors, even the general academic counselors, we invite the CSU people. And then the CSU people invite us to almost everything they're offering too, and so it's really fun to, get to know them. And actually, I was at a DSM-5 conference a month or two ago, and I saw one of the people from CSUs, and it was just comfortable to go sit by them and talk to them and have a nice day with them at the training that wasn't sponsored by either source, but it was a collaborative, community, professional comfort. We do some work with the non-public universities too, which might be a little bit different. We are very close to William Jessup University is in Rockland, and we are located in Rockland, and they have a counseling psychology program which offers a bachelor's program, and they have like an internship practicum hour requirement too. So they do some of the activities with us as far as participating in the mental health fair, setup, tear down, organization part. They're volunteers which help us work with campaign work, like when we're working to promote Cognito, or when we're doing Mental Health America Day or something like that. Some of those students from Jessup come on campus and volunteer with us to get some of their hours. I think it's important to include that. A lot of our students do transfer there. We're also in communication with National Brandman in Phoenix, just working, offering trainings as they're part of the community as well. Our focus is CSU and UC Davis, though. At Davis, they have CAPS program consultation. They've done a lot of trainings as far as ethics and online counseling, and we're working on expanding into doing apps and mental health screeners and all of that, and I think some of their training opportunities, which helped us learn about the different issues and things that could come up with that. That was offered through UC Davis, and they've come to all of our regional forum events, and then they invite us to trainings. They've done some technical collaboration with us to where we can work on some of our data collection, and that's very helpful. Transfer and continuum of care, I mentioned that. One thing we're looking at is sometimes mental health consumers who are Sierra students want to transfer, and we can, because we know them, we can say, because we know the programs at CSUS and at UC Davis, we're able to say, when you're there, they have this, this, and this. This is the building, this is the number, this is the person to call. And it's like an assistance bridge after transfer, because, we really want to make sure that they're taken care of when they go, and vice versa. Sometimes we get students that are at Sac State or at UC Davis, and they come back to Sierra for summers, or it's just helpful that we're communicating our services and resources as a partnership. Do you have any questions?
If you have any questions for Dr. Jenkins, go ahead and you can unmute your line by *6, and you can speak right over the phone, or you can type questions in the chat box. All right, well, thank you, Dr. Jenkins, for participating and sharing with us your collaboration efforts with the higher ed, and thanks for being on today.
Oh, thank you, and I feel very privileged to be, I'm looking at some of these names and positions, and it's just such a privilege to be able to speak with people outside of the area. It makes me feel, like we're all doing important work, and it's really a nice opportunity. Thank you so much.
Absolutely, thank you. And so next up we have Marge Razor from MiraCosta College to discuss their Suicide Prevention Council. Marge, are you on the line?
Yes. Can you hear me?
Yes. Hello.
Good afternoon, everyone. I'm Marge Razor, and I'm the Director of Student Health Services at MiraCosta College, and also the grant manager of the Student Mental Health Grant. Today I'm going to be speaking on the Suicide Prevention Council, the Higher Education Committee. This slide shows the colleges and universities in San Diego County that participate in the Higher Education Committee. They include UC San Diego, Cal State University San Marcos, University of San Diego City College, MiraCosta College, and San Diego State University. Just to give you a little history of the San Diego Suicide Prevention Council, in 2010, San Diego County awarded Community Health Improvement Partners a contract to form a suicide prevention action plan. This committee was made up of a wide variety of stakeholders that developed an action plan. Once this planning committee was ready for implementation, then the committee became known as the Suicide Prevention Council. The major stakeholders throughout the county participate monthly in the Suicide Prevention Council meetings. Over the past 4 years, though, 7 subcommittees have been formed. One of them is the Higher Education Committee. If you're interested in more information on the types of strategies that form the action plan, you can go to the website that I have listed there. Please note that through the remainder of this talk, while I refer to the county, it's really the community health improvement partners that are acting for the committee, for the county rather. One of the subcommittees that formed was this Higher Education Committee. This happened because of a recognized need. First, there was a school collaborative that formed early on. However, whenever the stakeholders broke up into working groups, the higher education issues were very different from the K-12 issues. And some of our regular attendees of the monthly Suicide Prevention Council meetings included representatives from colleges and universities that already received the Cal Mesa funding. And this group of people recognized the need to form a subcommittee. So we approached the county and they were willing to coordinate this. Once the Higher Education Committee formed, then the school collaborative was changed to the K-12 school collaborative. The bottom line in what elements really helped us succeed was the county support and making it easy to meet. First, we decided to meet monthly and decided that a teleconference would be the easiest, and that which also took care of the issue of where to meet. And it's really easy for us because the county takes care of the logistics of setting up the monthly teleconference call. They send out the meeting reminders with the monthly agenda. And finally, they also take care of the minutes and then distributing them to everyone. If you don't have a higher education committee in your area, I would suggest some tips for implementation. First of all, if you have a suicide prevention council already, then get active in it. If you don't have a higher education committee that's part of it, then try and start one. Collaborate with your county and ask them to coordinate your committee. We found that co-chairs were really important because everyone's busy and we all miss a meeting occasionally because we all have different campus schedules. Also, decide who should attend your meetings. We started out only with higher education partners. Then it was open up to anybody who was on the Suicide Prevention Council who wanted to participate. However, we found out that that didn't work so well, so now it's a closed committee. Next, be flexible with scheduling meetings. We all know that each semester our schedules vary. So every semester we look at the majority of the participants and pick a time and date that everyone can attend, or at least most of us. And then have a realistic agenda, and once it's accomplished, end the meeting. We're all busy, so if you've accomplished it, then just end. Getting started, we began with the universities and colleges in San Diego County who received the Cal Mesa funding. Most of us were already attending the monthly Suicide Prevention Council, as I said. And at our first teleconference, we had the mental health grant managers from all of the community colleges and the UC and state that I had listed on the poster earlier. Later, we tried to reach out to other colleges and universities in the county. At that time, the University of San Diego and Grossmont College also became regular participants. In getting started, we had to determine what goals and objectives we wanted to accomplish. Each campus representative shared what activities were planned related to their Cal Mesa funding, what they had done so far, and then how the group could help each other to maximize their efforts in funding. This information was later entered into a matrix that included the information here on the slide, the contact information, the activities or program, the trainings, the outreach and data, and then anything other that we felt important, and also the timeline. At that first meeting, we also shared what kind of immediate needs we had. Participants were interested in any free trainings that we could get through the county. Some were particularly interested in mental health first aid, train the trainers, and Safe Talk, along with any kind of contact information that the county could provide. Also, the county was already offering QPR and assist training. At other meetings, we were exploring ways to collaborate. First of all, we brainstormed various types of activities. Then we rank ordered our priority using SurveyMonkey, which was sent out by the county. First, we prioritized the activities based on our brainstorming. Then we rank ordered them as to how much time we were able to contribute to the activity. Third, we rank ordered on how much interest we had in it. And finally, we ranked the potential for the activity actually happening. And then our prioritization resulted in a desire to focus on peer activities. Most of us had some sort of a peer group. We wanted to be successful, so that was why we focused on these prioritizations. And then in terms of our accomplishments, one of them was Not on My Watch campaign. All of the higher ed campuses participated in a Not on My Watch campaign on their own campus during the same week, and we all tried to even have it on the same day. The county developed a template for a press release, which each of us presented to our PIO officer, and to advertise the combined effort of the San Diego County universities and colleges that were participating in the campaign the same week. The county also was helpful because they supplied each campus with the kits to distribute. As you can see in the picture, the students are wearing bracelets, and the kits included the red bracelet with Not on My Watch in white letters on one side, with the Suicide Crisis Hotline on the other side. The kits also included a 5x7 card with signs and symptoms of depression, and finally a business card with up to San Diego information that also included the crisis hotline. We also, as a group, did Out of the Darkness Walk. Those of us with mental health peers gathered together and participated as a unit in the American Foundation for Suicide Prevention's Out of the Darkness Walk. It was the first time that our peers had the opportunity to talk and share with peers from other campuses. Since our peers are trying to get certified, they found it very helpful because many of them are going to be going to some of these other local universities.
She had a question regarding some your dates or something for your longevity kind of thing.
Another accomplishment we had was a campus plunge each semester. And the campus plunge was a face-to-face meeting at a different college or university. That gave us an opportunity to see each other's facilities. At that time, we meet each other's providers at the hosting site. We share resources, handouts, and other types of information available at that location. And we get to see a larger number of people than get to come to the monthly meeting. We also had shared participation at our regional strategizing forums and conferences. MiraCosta College and San Diego City College, we co-hosted our regional strategizing forums. And at our first forum, we utilized 2 of the higher education committee members from UCSD as speakers. So they were very valuable in helping us get that first regional strategizing forum going. Cal State University and UCSD offered some really great trainings with their grant funding, and we were able to send some of our MST interns to these trainings, and they found them very valuable. Finally, our last accomplishment of this year has been a subcommittee presentation at our Suicide Prevention Council. In April, our Higher Education Subcommittee made a presentation to the Suicide Prevention Council, and the goal was to let all the stakeholders understand why colleges and universities were making referrals to community resources and why we couldn't do everything ourselves. They were always asking why we weren't able to case manage students on our own campuses. In getting the presentation together, the main thing that stood out were the similarities. We learned that we all provide similar services such as brief counseling, outreach, and peer education. We discovered that we shared many similar challenges such as an increased severity of mental health problems and increased number of students seeking mental health services. And in terms of our level of care, we all found that we provide short-term counseling, we have limited or no after-hour cares, and we have limited or no psychiatric services, especially with medications. Our meetings of late have focused on sustainability of our grant-funded programs and what the effect of the end of the grants will have on our higher education subcommittee. Our participants have expressed the value of the collaboration and sharing over the past 2 years. And now, does anybody have any questions?
And again, if you have any questions over the phone, please press *6 to speak directly to Marge, or you can type them in the chat box. It looks like there's a question in the chat box for you, Marge. It says, have you partnered up with local community organizations like NAMI?
Yes, we actually have started a NAMI on campus at MiraCosta College. About 3 months ago, it was officially recognized as an official NAMI on campus club, so we're really happy with that.
Mm-hmm. And Hector, are you with NAMI, I believe? I can see you you typing in the chat box. I was just curious. Are there any more questions for Marge? All right, well, thank you, Marge, for sharing your Suicide Prevention Council subcommittee meetings. We really appreciate your insight and experience.
Thank you.
And I'm going to go ahead and would like to welcome Kelsey Kehoe from Cuesta Community College.
Hear me?
Yes. Hello, Kelsey.
Hi. Hello, everyone. So my name is Kelsey Kehoe, and I'm a licensed therapist. I'm also the Wellness Arts Program Coordinator at Cuesta College and the Grant Manager for the Mental Health Program. So what I'm going to talk about today is a support group that we created, a student support group we created called Chill and Chat with the help of our local university, Cal Poly. So first, most of you know the framework of the Student Mental Health Program grant. So I'm going to focus on the peer-to-peer resource structure. Which
Kelsey? Sorry, I hate to interrupt you. Your phone line is cutting in and out a little bit. Are you on a speakerphone?
I am. Should I pick it up?
Yeah, could you pick it up and see?
Okay. Can you hear me?
Yeah, that's a lot better. Thank you.
Okay. Sorry, everyone. So as I was saying, the student support group falls under our peer-to-peer resource structure. And it started with our Active Minds Club. And so most of you, I realized that the
the PowerPoint slide is kind of not in line. I don't know if people can, or if it's just my screen, but it looks like some of the words are off the page, so sorry about that. But the Active Minds Club, for those of you that don't know what Active Minds is, it's a student-run club on campus, and I'm the advisor for Active Minds. And so we strive to change the culture on campuses and in the community by providing information, leadership, opportunities, and advocacy. I'm not doing that. Carrie, oh, can you guys hear me? Kari, hello? Okay.
Yes, we can hear you. Yeah, sorry, my line is muted. Yeah, sorry for the slides are a little bit off. They were emailed out. People can follow along with that.
Okay.
Yeah.
Okay, sorry. So anyway, so our Active Minds Club identified that we needed a student support group on campus. A lot of our Active Minds members joined Active Minds or were interested in Active Minds for the support structure that it creates, except it's not a support group. So the students were identifying that they felt like our campus needed a support group. We do provide individual counseling through our health center, but we don't have the capacity to offer group therapy. So with that idea, I identified an existing off-campus support structure for a possible collaboration. So California State University Cal Poly has an existing training program for Masters in Psychology, and they deliver therapeutic services to individuals at their community clinic as well as at various community sites. So we had an existing partnership with them, with their counseling clinic that would come to various outreach fairs and everything that we've done. So I decided to reach out to them to see if they would be interested in using Cuesta as a practicum site. And with that, I had to determine who to reach out to. So although we had an existing relationship, the student who was my contact was out for the summer. This all happened over the summer. So I went to their website, and this is just kind of a step-by-step of what we did to get this happening. So this is a screenshot of Cal Poly's website, and I just basically created an email, sent to all three of these supervisors that are circled. I found their emails up in the upper left-hand corner. This is a copy of the email if any of you are interested in that. And I did get a contact back from one of them who was actually the training site supervisor, and she was very enthusiastic for the partnership. So what she had to do was make a pitch to her practicum students for Cuesta being a group site, and 2 students were identified as being interested. So that started the process. We had some legwork on Cuesta's end. So we had to treat them as volunteers, and they had to go through a lengthy process to become one. So there was a volunteer request form that needed to be made or filled out. They both had to get TB tested and fingerprinted. Luckily, we were able to pay for the TB test and fingerprints through our grant funding, which helped them. There's a copy of the volunteer request form. I'm sure a lot of your colleges have something similar. And so we were able to get that going. I brought this all back to the Active Minds Club, and they were part of the planning and the brainstorm for the title of the group, which they had a lot of fun with. So they came up with the name Chill and Chat, and I created a flyer that's been sent out to all students. We send it out via campus email, and then there's flyers posted everywhere, and we created a big butcher paper rolling signboard that gets put out periodically. And this is the flyer that we created. And so I have some successes and challenges with the whole process. And let me see. I'm going to get to my notes so I can read it all. So with successes, we've had a consistent turnout. Usually it's the same students utilizing the service, so which has been great. And so it's become sort of a closed group, although new members can always join. It's just been the same students this semester. This is our first semester that we've done it. So There's been great feedback from the students as well as from the general campus community. And I feel like we've made a really strong collaboration with Cal Poly to keep this group going. There's a few challenges. One was the lag time between group leaders identified in Cuesta's legwork. So we identified the group leaders, and then it took about 3 weeks until we could get them started with all of the paperwork. Another challenge is that Cal Poly is on the quarter system and Cuesta is on the semester system. So about halfway through the semester, the group leaders changed. And the students were actually okay with it. And since I anticipated the lag time or the legwork, it wasn't as much time as before, so that was nice. Another challenge is since the student mental health funding will be over, we don't have a Cuesta employee that will be taking over this coordinating responsibility, but we're hoping that our student health center will take it over because it fits really well with them, and they refer a lot of their individual student clients to the group. So with that, I just buzzed right through that. Does anyone have any questions?
Any questions for Kelsey? You can press *6 to unmute your line or type in the chat box. No questions? Oh, there's a question for you. Kelsey, can you see the chat?
I can, yeah. So I can just answer the verbally, right? Yeah. So we have not thought about that. So that's a really good idea. Thank you. As far as I know, I don't think Cuesta uses any AmeriCorps volunteers, and I don't know why. So that's a good resource that I'll have to check out. Thank you.
Any more questions for Kelsey? All right, well, it looks like we have finished a little ahead of schedule. I do want to give a big thank you to Dr. Jenica Jenkins, Marge Razor, and Kelsey Kehoe for presenting and sharing your collaboration efforts with us. I want to thank all the participants for taking the time out of your day to spend with us. As you begin to log off and close out of our webinar system, there is a short evaluation form that will pop up on your screen. If you can just take a moment to complete that form, provide us with your feedback, it does help us improve these sessions for the future. So again, thank you all for joining us, and I wish you all a very happy afternoon. Thank you.